Let's talk about training around pain and what typical physical therapists do to address that. So we've got an athlete who needs to be doing a prescribed goblet squat. So if we have Erin do a goblet squat and she has anterior knee pain, first thing physical therapists will do is say, well, let's get rid of the weight or decrease the weight. So now if she does it, now we're going to get less co-contraction of all the musculature throughout the lower extremities, which decreases the effectiveness of this lift. Next thing that physical therapists will do is say, well, let's decrease the range of motion. So we keep the weight the same. Now we only do a quarter squat instead of a full squat. What's that do? Once again, decreases facilitation of the muscles that are involved because now they're only going through a partial range of motion, and this is not going to mimic the positions that she's going to get in with her sports, which makes this a dysfunctional exercise. Third thing that people will do is say, well, let's get rid of a front anterior load and change it to a posterior load and do a bar squat. That's not what was prescribed. So hopefully her strength and conditioning coach is prescribing these exercises for a purpose. We've just changed the entire exercise so we can train around something that's painful because we never assessed what the root cause of the problem is. What we should be doing is assessing the root cause, figuring out which muscles aren't contracting, aren't facilitated, reverse that, then have her do the exercise as prescribed, full range of motion, normal weight.